Hello, I'm Dr. Hagee. Which is the best medicine for my bipolar disorder? That depends on several things. First, what phase are you in? Are you in a depressed or manic or mixed phase? The same medicines work for the manic and the mixed phase most of the time, and the depressed phase is treated with a different algorithm, or decision tree we call it. Secondly, how severe and urgent are your symptoms at this time? Our most potent medications that work faster often have more side effects. And thirdly, what has you or your relatives' experience been with a particular agent? If you had a good response or you had side effects to a previous medication, that same one will probably give you the same responses again. And if you had a close family member who responded to a particular medication, you're more likely to respond to that one than if we just chose randomly. Now I'll talk about the different medications we use in the different phases of bipolar disorder. The first phase I'll talk about is the manic or hypomanic phase. Hypomanic phase is a mildly manic phase. Our first-line medications in this family are the mood stabilizers that are dopamine blockers, which are Geodon, Abilify, Risperdal, or Seroquel, or other mood stabilizers like lithium or Depakote. If one of these fails or has side effects, then we move on to another member of this family. If you have a partial response to one of them, then we'll add another one to that one. If this all fails, then we move on to the second group of medications for manic phase. These medicines don't have as much scientific evidence of their effectiveness, or they have more side effects. These medicines include Zyprexa, Tegretol, Trileptal, older mood-stabilizing dopamine blockers as Haldol, or Clozaril. If one or a combination of two of these medications, or a combination of one of these medicines with medicine from the first family don't work, then we move on to a combination of three medicines, or ECT. I'll talk about some of these specific medications a little later on. Now I'll talk about the mixed phase of bipolar disorder and the medications we use. The medications we use for this phase are identical in the decision tree or algorithm as we use for the manic phase, except for a couple small differences. If you are in a irritable state, we don't use lithium or Seroquel until further down in the decision tree, because they are not as effective in a mixed phase as they are in a manic phase. Otherwise, the decision tree is pretty much the same as the manic phase. Now I'll talk about the medications we use for bipolar depression phase. The first line medicine is Lamictal. If you're already on a mood stabilizer, we add the Lamictal to it. If this fails, the next recommended step is Zyprexa with Prozac or Seroquel. If that fails, we move on to a combination of lithium, Lamictal, Seroquel, or Zyprexa with Prozac. If this fails, we move on to a combination or substitution with a next family of medicines that have less scientific evidence of their effectiveness. These medicines include Tegretol, Trileptal, Depakote, Mirapex, Inositol, stimulants, or thyroid. ECT is a strong consideration here as well. Now I'll describe how I actually choose medications I use for my patients. If a patient comes to me in a manic phase, I will generally choose Geodon first. There are two reasons. One is it tends to work faster than Abilify or Depakote. And two, it has lower risk of weight gain than any of the others in the dopamine blocking family, which include Abilify, Seroquel, Risperdal, or Zyprexa, or the other mood stabilizers, Depakote, Tegretol, or lithium. I tell my patients that starting on Geodon is a little like joining a fraternity or sorority. There's a 25% chance that you'll develop some muscle side effects in the first couple weeks. However, these are very treatable, temporary, and I educate my patients about the details of these side effects and give them side effect pills to have in case they develop them. If they do develop them, in 30 to 60 minutes the side effects are usually gone and the person can go on to enjoy the benefits of Geodon. If Geodon fails to work or has side effects that are intolerable, then I go on in this order: Abilify, Depakote, Risperdal, Seroquel, lithium, Tegretol, or Trileptal. Now I'll describe how I treat bipolar mixed phase, where you have depression and manic symptoms together at the same time. Usually the protocol is just the same as with mania, except for two changes. I tend to add Lamictal earlier to try to help with the depression symptoms, and I will add lithium later in the algorithm because it tends to be less effective in this population. And finally, bipolar depression. Usually I start with Lamictal. If the person's already on a mood stabilizer, I add the Lamictal to it. If the person's on an antidepressant, my goal will be to try to taper them off it when they're starting to come out of their depression. There are three reasons. One is typical antidepressants have a significant risk of causing a manic or a hypomanic episode. Two, they tend to increase mood instability over time with increased frequency and or intensity of mood swings into highs or low. And third, the studies have shown that only about 20% of bipolar depressives respond to typical antidepressants without a mood instability side effect. If Lamictal fails to help bipolar depression or has intolerable side effects, I will usually move on directly to Mirapex. I skip over several medications because of other issues. The medicines I skip over are Zyprexa with Prozac, Seroquel, lithium, and Depakote, and typical antidepressants because of weight gain, metabolic issues, sexual side effects, or lack of scientific evidence. There is growing scientific evidence for Mirapex's benefit in bipolar depression. I've treated over 200 patients in the last couple years with Mirapex with many successes. You can read about Mirapex on my blog at www.eveningpsychiatrist.blogspot.com. If Mirapex fails or has intolerable side effects, then I move on to the medications I skipped over. If those fail, then I move on to ECT, other atypical antipsychotics, stimulants, thyroid, Trileptal, or MAOIs. Most patients benefit by having a therapist as well. The most effective form of therapy is cognitive behavioral therapy. Call us today for the most effective medications that we have today.